3 case studies involving telepathic hypnosis. Here we have 3 case studies that are representative of those cases where the patient has been hospitalised and placed into psychiatric care under a diagnosis of psychosis. In all 3 cases, the interventionist team comprised of 2 practitioners, myself, the therapist, and my colleague, Andrew Porter, a medium. Collectively, the team are referred to in the document as the interventionists. The family of each patient and the family members of each patient are referred to as the family. And the subject of the intervention is known as the patient or by his pseudonym. Now, all communications between the family and we, the interventionists, were by email only. And at no time were the interventionists in direct contact either by email, telephone, Skype, face-to-face, or by any other means with the patient, with the exclusive exception of telepathy. Now, I live and work in South East Kent. My colleague, Andrew the medium, lives and works in Wiltshire. And there's quite a distance between us. We never meet face-to-face, or rarely meet face-to-face, so we work together using Skype. All the families cited in these 3 cases have given their consent for their cases to be studied for education and research purposes. All references to locations and personal circumstances have been disguised in order to maintain anonymity and confidentiality. Now, as an introduction, let me say, mainstream psychology and psychiatry remain sceptical about the validity of non-orthodox methods of healing a distressed mind, and maintain that all mental, emotional and behavioural sicknesses are the result of biological, genetic or environmental stressors. From this mechanistic perspective, it will be argued that any so-called communication with a patient at a distance by means of telepathy through a medium must be the result of the medium's active imagination or deliberate fraud. This is because any notion of a spiritual dimension is refuted and ignored by the mainstream. So in order to qualify telepathic hypnosis through mediumship as a valid and valuable intervention modality, it is essential that such communications are subjected to tests of efficacy and validity. Now, with the application of Myers' criteria for credibility and validity, and just as a reminder, F.W.H. Myers was one of the founding fathers of the Society for Psychical Research in London in 1882, and he spent 20 years collecting evidence and establishing a scientific framework for the study of psychic and spiritual phenomena. And his scientific criteria for credibility and validity, together with a positive health outcome for the patient, we may be able to establish such efficacy. Any evidence for the efficacy of telepathic hypnosis will continue to be challenged by mainstream medicine. It's therefore important that the evidence presented is externally validated, qualified and viewed seriously by independent research analysts and by open-minded clinicians who may wish to avail themselves of an additional complementary approach for the treatment of their patients' mental and emotional health and well-being. Now, in the first instance, evidence of efficacy, validity and therapeutic value of the telepathic hypnosis interaction must come not from a biased psychiatric perspective, but from the patient's responses as reported by the family. Further evidence will be provided by detailed analysis of qualitative discourse between the patients and their carers and family members. Now, the method used with these three cases. Under normal, that is traditional hypnotherapeutic circumstances, the patient and the therapist would be in a one-to-one, face-to-face situation where the therapy would be applied with the conscious cooperation of the patient. Now, in contrast with this traditional method, the application of telepathic hypnosis is conducted through a medium. The therapist, that is myself, the medium, and the patient are not in direct face-to-face contact with each other at all. The therapist will ask the medium to go into an altered state of consciousness, or trance if you'd like to call it that, and connect with the spiritual mind of the patient. The medium can then convey the thoughts and feelings of the patient to the therapist, and the therapist can influence the thoughts and feelings of the patient through the medium. In addition, the therapist and the patient can converse with each other, bypassing the awareness of the medium as if the medium didn't exist. These interactions are conducted beyond the conscious awareness of the patient. Of course, he's at a distance, and he may or may not have any memory of these interactions. And in a moment we're going to have a look at the first case study, but for now that's what this project is all about.